Explain the fundamental physics behind the production of X-rays. How do the characteristics of X-rays influence their interaction with biological tissues? Answer: X-rays are produced when high-speed electrons collide with a metal target, typically tungsten, within an X-ray tube. The collision results in two main processes: characteristic radiation and bremsstrahlung radiation. Characteristic radiation occurs when an electron from the inner shell of the target atom is ejected, causing an outer shell electron to fall into the vacancy. This transition releases energy in the form of an X-ray photon. Bremsstrahlung radiation results from the deceleration of electrons as they approach the nucleus of the target atoms, producing a spectrum of X-ray energies. The characteristics of X-rays include high energy and short wavelength, allowing them to penetrate biological tissues. The degree of penetration and absorption varies with tissue density. Dense tissues like bone absorb more X-rays than less dense tissues like muscle. This differential absorption forms the basis for contrast in radiographic images, with denser areas appearing lighter on the image due to higher absorption. Differentiate between conventional radiography and digital radiography. Discuss the advantages of digital radiography over traditional film radiography. Answer: conventional radiography uses film to capture images, whereas digital radiography employs electronic sensors or photostimulable phosphor plates. Key differences and advantages of digital radiography include image acquisition and processing. Digital systems allow for immediate image acquisition and display, reducing waiting time for patients and improving workflow. Image quality. Digital radiography provides superior contrast resolution, enhancing the ability to distinguish subtle differences in tissue density, which can be critical for early diagnosis. Post-processing capabilities. Images can be manipulated, e.g., adjusting brightness, contrast after acquisition, improving diagnostic utility. Radiation dose reduction. Digital systems often require low radiation doses to achieve comparable image quality to film systems, thereby minimizing patient exposure. Storage and retrieval. Digital images can be easily stored, retrieved, and shared electronically, facilitating telemedicine and second opinions. Describe the process of image reconstruction in CT imaging. What advanced techniques can enhance CT imaging results, particularly in angiography? Answer: in CT imaging, image reconstruction is the process of converting raw data obtained from multiple X-ray projections into a cross-sectional image. The steps include data acquisition. X-ray detectors capture data from multiple angles as the patient moves through the gantry mathematical algorithms. Raw data is processed using algorithms like filtered back projection (FBP) or iterative reconstruction to construct a twad image from the 3D data. Image display. The reconstructed images can be viewed in different planes: axial, coronal, sagittal, and manipulated for diagnostic evaluation. Advanced CT techniques include CT angiography (ETA). Utilizes contrast media injected into the bloodstream to visualize blood vessels, significantly enhancing the visualization of vascular structures. Dual entity CT involves acquiring images at two different energy levels, allowing differentiation between materials, e.g., distinguishing between iodine in vessels and calcification in arteries. Dr. Smith is performing a CT scan on a patient who has a known allergy to iodine-based contrast media. What steps should Dr. Smith take to ensure the safety of the patient while still obtaining necessary diagnostic information? Answer: Dr. Smith should follow these steps. Assess the patient's allergy. Confirm the nature and severity of the patient's allergy to iodine-based contrast media. Determine if a previous reaction occurred and the specifics of that reaction. Alternative imaging techniques. Consider alternative imaging modalities that do not require contrast media, such as MRI or ultrasound. If appropriate for the clinical scenario, use non-iodinated contrast agents. If a contrast-enhanced study is necessary, discuss the use of non-iodinated contrast agents, e.g., barium sulfate for gastrointestinal studies, or the option of water-soluble contrast, provided it is suitable for the examination. Pre-medication protocols. If non-iodinated options are not viable, an iodine-based contrast is required. Consult the institution's protocols for pre-medication, e.g., administering corticosteroids and antihistamines to minimize the risk of an allergic reaction. Informed consent. Ensure the patient is informed about the risks and benefits of the chosen imaging method. Obtaining informed consent. Discuss the role and application of radiopharmaceuticals in nuclear medicine. How do T and SP CT imaging techniques utilize these agents differently? Answer: radiopharmaceuticals are compounds that contain radioactive isotopes and are used in nuclear medicine for both diagnostic and therapeutic purposes. Their role includes Diagnostic imaging. Radiopharmaceuticals are administered to the patient, targeting specific organs or systems, e.g., thyroid, bone. They emit gamma rays detectable by imaging devices. Therapeutic applications. Some radiopharmaceuticals can be used to treat conditions such as iodine 131 for hyperthyroidism or certain cancers. Positron emission tomography (PET) utilizes positron emitting isotopes G-fluorine 18 attached to glucose analogues FDG for metabolic imaging. PET scans measure metabolic activity, identifying cancerous lesions based on increased glucose uptake. Single photon emission computed tomography (SPECT) uses gamma-emitting isotopes G-technetium-99 meters for imaging. SPE CT provides information about blood flow and functional activity in organs, being particularly useful in cardiac imaging. What are the key historical milestones in the development of radiology that have shaped its current practice? Answer: several key milestones have significantly influenced the evolution of radiology. Discovery of X-rays, 1895. Wilhelm Conrad Röntgen discovered X-rays, marking the birth of radiology and enabling the visualization of internal structures without invasive procedures. Development of fluoroscopy, 1896. Thomas Edison's invention of the fluoroscope allowed real-time imaging, expanding diagnostic capabilities. Introduction of radiotherapy, early 20th century. The use of X-rays in cancer treatment began, paving the way for therapeutic radiology. Advancements in imaging techniques, 1950s-1970s. The introduction of computed tomography (CT) in the 1970s revolutionized diagnostic imaging, enabling cross-sectional views of the body. Emergence of MRI, 1980s. Magnetic resonance imaging provided non-ionizing imaging options, significantly enhancing soft tissue evaluation. Digital imaging revolution, 1990s-2000s. The transition from film to digital radiography improved image quality, storage, and accessibility, leading to advancements in telemedicine and remote diagnostics. Explain the techniques used in interventional radiology and discuss the indications and potential complications associated with these procedures. Answer: interventional radiology involves minimally invasive procedures guided by imaging techniques. Common techniques include angiography and angioplasty, imaging of blood vessels using contrast agents to diagnose vascular conditions. Angioplasty involves ballooning narrowed vessels and may include stent placement. Biopsy. Imaging-guided needle biopsies allow for the sampling of tissue from suspicious lesions while minimizing damage to surrounding tissues. Drainage procedures. Placement of catheters under imaging guidance to drain abscesses or fluid collections. Embolization. The intentional occlusion of blood vessels to treat conditions like uterine fibroids or tumors. Indications for vascular disease e.g. aneurysms, peripheral artery disease. Tumor treatment e.g. tumor embolization, ablation, gastrostomy tube placement in patients requiring long-term feeding. Potential complications: infection at the puncture site, hemorrhage or hematoma formation, allergic reactions to contrast media, injury to surrounding organs or structures. Careful patient selection and procedural technique are crucial in minimizing complications. Describe the principles of ultrasound imaging. What are the advantages of Doppler ultrasound in assessing blood flow compared to standard ultrasound techniques? Answer: ultrasound imaging utilizes high-frequency sound waves to create images of internal structures. The key principles include sound wave emission. A transducer emits sound waves that penetrate the body and reflect off tissues with different structures, reflecting sound differently based on their density. Echoreception. The reflected sound waves return to the transducer, which converts them into electrical signals, forming real-time images. Advantages of Doppler ultrasound. Assessment of blood flow. Doppler ultrasound evaluates the velocity and direction of blood flow in vessels, making it essential for diagnosing vascular conditions. Color Doppler imaging. This technique visually represents blood flow, direction, and velocity, enhancing the understanding of hemodynamics. Non-invasive and safe. Doppler ultrasound is radiation-free, making it safe for repeated assessments, particularly in vulnerable populations, e.g. pregnant women, children. Discuss the physics behind MRI and the safety considerations that must be addressed when using this imaging modality. Answer: MRI operates on the principles of nuclear magnetic resonance (NSR). Key elements include magnetic field. A strong magnetic field aligns hydrogen nuclei, protons in the body. Radio frequency pulses. When radio frequency (RF) pulses are applied, protons absorb energy and transition to a higher energy state, relaxation and signal emission. As protons return to their original state, relaxation, they emit RF signals, which are detected to create images. Two primary relaxation times are measured, longitudinal and T-transverse, which help differentiate tissues. Safety considerations. Magnetic field risks. Patients with certain implants, e.g., pacemakers, ferromagnetic devices, may be at risk. A thorough screening process is essential. Claustrophobia and anxiety. Some patients may experience anxiety in the confined space of an MRI machine. Providing reassurance or using open MRI machines can help. Contrast media risks. Gadolinium-based contrast agents used in MRI can pose risks of nephrogenic systemic fibrosis in patients with renal impairment. Renal function should be assessed before administration. Evaluate the benefits and limitations of using dual-energy CT for the differentiation of materials within the body. How does it enhance diagnostic capabilities in specific clinical scenarios? Answer: dual-energy CT DECT utilizes two different energy levels of X-rays to provide enhanced material differentiation based on the different attenuation characteristics of substances at various energy levels. Benefits: material differentiation. CT can distinguish between materials, e.g., iodine, calcium, fat, based on their energy-dependent attenuation, improving the characterization of lesions and vascular structures. Improved diagnosis of kidney stones. CT can identify different types of kidney stones by differentiating calcium-based stones from non-calcium stones, guiding treatment decisions. Reduction in artifacts. Dual-energy imaging can reduce beam-hardening artifacts, improving image quality in complex anatomical regions, e.g., areas with high-density materials. Evaluation of tumors. Enhanced ability to visualize and quantify perfusion and vascularity in tumors, aiding in the assessment of tumor response to therapy. Limitations. Increased radiation dose. Dual-energy CT can expose patients to higher radiation doses compared to standard CT, necessitating a careful risk-benefit analysis. Cost and availability. CT technology may not be available in all facilities, and its implementation may involve higher costs. In clinical scenarios where precise material characterization is critical, e.g., oncology, urology, CT significantly enhances diagnostic capabilities, leading to improved patient management. Discuss the different types of fractures and the preferred imaging techniques used for each. What factors should a radiologist consider when selecting an imaging modality for fracture assessment? Answer: fractures can be classified into several types, including closed versus open fractures. Closed fractures have intact skin, while open fractures involve a breach in the skin. Complete versus incomplete fractures. Complete fractures involve a full break through the bone, while incomplete fractures like green stick fractures do not fully extend through the bone. Transverse, oblique, and spiral fractures. The orientation of the fracture line distinguishes these types, impacting the mechanical forces involved. Imaging techniques. X-rays. The first-line imaging modality for suspected fractures. They are quick and provide essential information about fracture alignment and type. CT scans. Useful for complex fractures, particularly in areas like the pelvis or spine, where conventional X-rays may be inconclusive. Employed when stress fractures or soft tissue injuries accompany bone injuries, offering superior soft tissue contrast. Factors to consider. Patient factors, age, comorbidities, and the ability to cooperate during the imaging process. Fracture location and complexity. Simple fractures may only require X-rays, while complex cases could necessitate CT or MRI. Radiation exposure. Minimizing exposure is critical, especially in pediatric patients. What imaging modalities are most effective in diagnosing osteomyelitis, and what key imaging findings would indicate this condition? Answer: the most effective imaging modalities for diagnosing osteomyelitis include X-ray. Often the first imaging step, however, it may show changes only after a significant period, 2-3 weeks. Early signs include bone cortex discontinuity and soft tissue swelling. MRI, the gold standard for osteomyelitis diagnosis due to its high sensitivity for bone marrow edema and soft tissue involvement. Key findings include hyperintense areas on twatted images, involvement of the medullary cavity and cortical bone, abscess formation indicated by fluid collection. CT scan, useful in detecting bony changes, especially in chronic cases where changes may be more apparent. Bone scintigraphy can be used for detecting osteomyelitis, particularly in cases where other modalities yield inconclusive results. Increased uptake on a bone scan indicates increased metabolic activity associated with infection. Key imaging findings: periosteal elevation, cortical bone destruction, marrow edema on MRI, soft tissue abscess. Mr. Fisher, a 55-year-old male with a history of hypertension, presents with sudden onset chest pain and dyspnea. A CT angiogram reveals a thoracic aortic dissection. What immediate actions should the radiologist recommend, and what follow-up imaging is typically required? Answer: in the case of Mr. Fisher, immediate actions include immediate consultation with the treating physician to discuss the severity of the dissection and the potential need for surgical intervention, review of imaging findings, confirm the extent of the dissection, e.g. type of versus Type B, and any involvement of branch vessels, recommendation for urgent surgical evaluation. Type A dissections typically require surgical intervention, while Type B may be managed conservatively in some cases. Follow-up imaging, repeat CT angiogram, usually performed within 2-4-8 hours to assess for progression of the dissection or complications such as aneurysm formation. Transesophageal echocardiogram, T, may be performed in some cases to further evaluate cardiac involvement or complications. What are the imaging modalities used to diagnose venous thromboembolism, VTE, and what specific findings would indicate the presence of a deep vein thrombosis? Answer: the primary imaging modalities for diagnosing VTE include ultrasound as the first-line modality for suspected DVT. Key findings include absence of compressibility of the vein, echogenic material within the venous lumen, thrombus, lack of venous flow on Doppler studies, CT venography, CTV, used when ultrasound is inconclusive or in cases of suspected pulmonary embolism. Key findings include non-opacified segment of a vein indicating thrombosis, presence of collateral circulation in chronic cases, magnetic resonance venography, MRV, occasionally used particularly in patients where radiation exposure is a concern. Explain the significance of staging in oncology and the imaging modalities commonly employed for tumor staging. What are the key imaging features used in this process? Answer: staging is crucial in oncology as it helps determine the extent of disease, guides treatment decisions, and influences prognosis. The primary imaging modalities for tumor staging include CT scans, commonly used for most solid tumors to evaluate the primary tumor, lymph node involvement, and distant metastases. Key features include tumor size, shape, and characteristics of surrounding tissues. MRI, particularly useful in assessing brain tumors and soft tissue tumors, provides detailed information about tissue involvement, edema, and vascularity. PET scans, valuable for detecting metabolic activity of tumors, particularly in lymphoma and lung cancer. Key imaging findings include areas of increased fluorodeoxyglucose (FDG) uptake. Key imaging features: size and borders of the primary tumor, involvement of lymph nodes, number, size, and location, presence of metastases in other organs. Discuss the role of imaging in the diagnosis and management of autoimmune disorders such as rheumatoid arthritis. What imaging techniques are used and what specific findings are indicative of disease activity? Answer: imaging plays a critical role in diagnosing and managing autoimmune disorders like rheumatoid arthritis, RA. The main imaging techniques used include X-rays, often the initial imaging study, particularly for assessing joint damage over time. Key findings include joint space narrowing, erosions, and soft tissue swelling. Ultrasound, increasingly utilized to evaluate synovitis and effusions in joints. Features indicating disease activity include increased vascularity on Doppler studies and fluid collections. MRI, useful for assessing early joint changes and detecting bone marrow edema, which indicates inflammation. Key findings include synovial thickening, effusions, and erosive changes in the bone. CT scans, sometimes employed in complicated cases, especially for assessing extra-articular manifestations. What are the key guidelines for obtaining a chest X-ray in suspected pneumonia? Include specific positioning, exposure settings, and essential views to ensure optimal imaging quality. Answer: key guidelines for obtaining a chest X-ray in suspected pneumonia include positioning. Anterior-posterior at view is acceptable in a supine patient, but an upright or semi-upright position is preferred to visualize the lungs more clearly and assess for pleural effusions. A lateral view can be beneficial for better visualization of pleural effusions and to differentiate pneumonia from other pathologies. Exposure settings. Adequate penetration is crucial. Use appropriate kilovolt peak (kVp) settings to ensure soft tissue structures are visible while avoiding overpenetration. Use at low mA/s. Mass setting to minimize radiation exposure. Essential views. PA view provides a standard view of lung fields, heart size, and mediastinal structures. Lateral view helps assess the posterior structures of the lungs and may reveal subtle effusions or mass lesions. Describe the imaging protocols for evaluating osteoarthritis of the knee. What specific views and parameters should be included to ensure a comprehensive assessment? Answer: the imaging protocols for evaluating osteoarthritis OA of the knee should include standard X-ray views. AP view captures joint space narrowing and osteophyte formation. Lateral view provides insights into the patellar positioning and joint alignment. Sunrise view, merchant view, specifically assesses the patellofemoral joint for osteophytes and patellar subluxation. Additional views, weight-bearing views, helpful in assessing functional changes in joint space and alignment. Oblique views may be useful to visualize specific anatomical features not seen in standard view MRI, considered if there are soft tissue concerns or to assess cartilage integrity and bone marrow lesions. Key parameters include twatted and twatted images to visualize cartilage thickness, bone marrow edema, and synovial changes. What are the key imaging modalities and their protocols used for assessing gastrointestinal GI tract pathologies, particularly in cases of suspected bowel obstruction? Answer: the primary imaging modalities and protocols for assessing GI tract pathologies, especially suspected bowel obstruction, include X-ray, the first-line imaging modality for suspected bowel obstruction. Supine and upright abdominal X-rays are typically performed to assess for air fluid levels, distension of bowel loops, and signs of obstruction. CT scan, the preferred modality for further evaluation. Protocol: an abdominal CT with oral and/or intravenous contrast is recommended. Look for distended loops of bowel, transition points, presence of free air or fluid. Ultrasound, especially useful in pediatric patients to assess for intussusception or in pregnant patients. Key features include the target sign and altered blood flow patterns in cases of ischemia. Explain the common post-traumatic complications observed on imaging studies following orthopedic trauma. What key imaging findings should be assessed to identify these complications? Answer: post-traumatic complications commonly observed on imaging studies following orthopedic trauma include malunion or non-union. Radiographic evidence of improper healing or lack of healing can be identified on X-ray by assessing bone alignment and callus formation. Osteomyelitis. As discussed previously, X-rays may show bone destruction, while MRI will provide more definitive findings such as marrow edema and abscess formation. Compartment syndrome. While diagnosed clinically, imaging can help rule out other causes of swelling. An MRI may reveal muscle edema and fluid accumulation. Joint effusion. An accumulation of fluid in the joint space may be evaluated via ultrasound or MRI, providing insights into underlying issues post-injury. Key imaging findings: joint space widening, presence of foreign bodies or hardware issues, soft tissue abnormalities surrounding the fracture site. What are the key factors to consider when optimizing positioning and technique in radiography, and how can improper positioning affect diagnostic outcomes? Answer: when optimizing positioning and technique in radiography, several key factors must be considered. Anatomical considerations. Understanding the anatomy of the region being imaged is crucial. Incorrect positioning can lead to superimposition of structures, making it difficult to visualize specific areas. Image quality parameters. Factors such as exposure time, kilovoltage, kV, and milliampere seconds mass should be adjusted based on the patient's size, the body part, and the imaging requirements. For example, increasing kV enhances penetration but can reduce contrast. Patient comfort and safety. Proper positioning also involves ensuring patient comfort and minimizing motion artifacts. Techniques such as using positioning aids or supporting devices can help achieve this. Regulatory guidelines. Following guidelines such as those from the American College of Radiology (ACA) and Radiological Society of North America (RSNI) can ensure optimal technique and compliance with safety standards. In what scenarios would the use of gadolinium-based contrast agents in MRI be contraindicated, and what management strategies should be implemented in such cases? Answer: gadolinium-based contrast agents (GBA) are contraindicated in the following scenarios: renal impairment. Patients with severe renal dysfunction, equa 30 ml min, are at risk of developing nephrogenic systemic fibrosis (NSF) when exposed to GBCA. A thorough renal assessment should be conducted before administration. Allergic reactions. A history of allergic reactions to gadolinium or other contrast media may warrant avoidance of GBCA. Pre-medication with corticosteroids can be considered for patients with a history of mild to moderate reactions. pregnancy. Although no definitive evidence shows adverse effects of GBCA in pregnancy, they are generally avoided unless absolutely necessary due to potential risks to the fetus. Management strategies for patients with renal impairment include alternative imaging, using non-contrast MRI techniques or other modalities like ultrasound or CT without contrast, hydration protocols, ensuring adequate hydration pre and post-MRI to minimize nephrotoxic effects. Mr. Schmidt is scheduled for a CT scan with contrast media to evaluate for possible pulmonary embolism. However, upon reviewing his medical history, you notice he has a significantly elevated creatinine level. What steps should you take regarding the use of contrast media for this procedure? Answer: in Mr. Schmidt's case, the elevated creatinine level indicates possible renal impairment, which raises concerns about the use of contrast media. Here are the steps to follow. Assess renal function. Confirm the elevated creatinine levels with a full renal function panel to determine the EGFR. If the EGFR is less than 30 mmHg, the use of contrast is contraindicated. Consult with a radiologist. Discuss Mr. Schmidt's case with the radiologist to determine if the CT scan is essential. Alternative imaging modalities such as ECAN may be considered if the CT with contrast is deemed non-essential. Consider pre-medication. If the CT is essential and renal function allows it, consider pre-medication protocols, hydration, and acetylcysteine to mitigate potential nephrotoxicity. Obtain informed consent. Ensure that Mr. Schmidt understands the risks associated with contrast administration in the context of his renal function and document this discussion. Post-procedure follow-up. If the contrast is administered, monitor Mr. Schmidt for any signs of acute kidney injury post-scan and conduct follow-up renal function tests. Describe the differences between ionic and non-ionic contrast agents, including their implications for patient safety during imaging procedures. Answer: ionic and non-ionic contrast agents differ primarily in their chemical structure and osmolality, which have significant implications for patient safety. Chemical structure: ionic contrast agents. These agents dissociate into charged particles in solution, leading to higher osmolality compared to blood plasma. This can increase the risk of adverse reactions, particularly in vulnerable populations. Non-ionic contrast agents. These agents do not dissociate, resulting in lower osmolality. They are generally better tolerated, leading to fewer side effects. Adverse reactions. Ionic agents. Higher incidence of adverse reactions, including nausea, vomiting, and severe anaphylactic responses. They may also increase the risk of renal impairment due to osmotic nephrosis. Non-ionic agents. Lower incidence of adverse reactions, making them safer for patients, particularly those with prior allergic reactions or renal impairment. Clinical implications. Non-ionic agents are preferred in most imaging protocols due to their improved safety profile. Guidelines from the American College of Radiology recommend using non-ionic contrast agents for routine procedures unless contraindicated. Cost considerations. Non-ionic agents are typically more expensive than ionic agents, but their safety advantages often justify the higher cost in clinical practice. What are the common indications and contraindications for performing interventional procedures such as biopsies or drainage in radiology? Answer: indications for interventional procedures. Biopsy: to obtain tissue samples for histological diagnosis, especially in cases of suspected malignancy or infection. Image-guided biopsies, CT, ultrasound, are preferred for targeting lesions that are difficult to access. Drainage: to relieve symptoms or complications from fluid collections, e.g. abscesses, hematomas, or cysts, indicated when conservative management fails or immediate intervention is necessary. Contraindications: coagulation disorders, patients with bleeding disorders, e.g. thrombocytopenia, or those on anticoagulant therapy may be at increased risk of hemorrhage. Infection at the site of intervention. Performing procedures in infected areas increases the risk of spreading the infection. Severe anatomical distortions. In cases where anatomy is distorted, e.g. due to prior surgeries, accurate targeting may be compromised. Patient uncooperativeness. Sedation or local anesthesia may be required, and patient cooperation is critical for the success of the procedure. Explain the role of advanced imaging techniques, such as perfusion imaging in CT, and their clinical applications. Answer: advanced imaging techniques. Perfusion imaging in CT assesses blood flow to tissues, providing valuable information beyond standard imaging. Key aspects include technical approach. Perfusion imaging involves dynamic contrast-enhanced techniques where contrast is injected and images are taken rapidly to track contrast flow through tissues. Clinical applications. Oncology, evaluating tumor vascularity and response to treatment. Tumors with higher perfusion often indicate aggressive behavior. Neurology. Assessing cerebral perfusion in conditions like stroke, rapid identification of ischemic areas is crucial for timely intervention. Cardiology. Evaluating myocardial perfusion to diagnose coronary artery disease and assess heart function. Interpreting results. Analysis of perfusion maps can identify areas of hyperperfusion, aiding in diagnosis and treatment planning. Discuss the potential complications of angiography and stenting procedures and describe the recommended post-procedure care. Answer. Potential complications: hemorrhage, access site bleeding can occur, particularly in patients with coagulopathy. Pressure dressings and monitoring are essential. Thrombosis. Thrombus formation can occur at the stent site, leading to acute vessel occlusion. Dual antiplatelet therapy (DAT) is crucial to minimize this risk. Allergic reactions. Patients may experience allergic reactions to contrast agents used during angiography. Monitoring for adverse effects and having emergency protocols in place is essential. Infection. Infection at the catheter insertion site can lead to serious complications. Prophylactic antibiotics may be warranted for high-risk patients. Post-procedure care. Monitoring. Patients should be closely monitored for signs of complications, including vital signs and access site assessment. Medication management. Patients typically receive antiplatelet medications e.g. aspirin, clopidogrel, post-procedure to prevent thrombotic events. Patient instructions. Educating patients on signs of complications e.g. increased pain, swelling, or redness at the access site for timely reporting. Follow-up imaging. In some cases, follow-up imaging may be necessary to assess the success of the procedure and the condition of the stent. Analyze the technical factors affecting ultrasound image quality and how they can be optimized during examinations. Answer. Technical factors affecting ultrasound image quality. Transducer selection. The choice of transducer frequency impacts image resolution. Higher frequencies provide better resolution but less penetration, suitable for superficial structures, while lower frequencies penetrate deeper but may reduce resolution. Patient preparation. Proper fasting or hydration may be necessary to optimize visualization of specific organs e.g. fasting for gallbladder studies. Gain and dynamic range. Adjusting gain settings enhances the visibility of structures. Adequate dynamic range settings allow for better differentiation of tissues with varying echogenicities. Acoustic windows. The acoustic properties of the medium through which ultrasound travels e.g. fat muscle affect image quality. Utilizing appropriate windows and positioning can enhance visualization. Doppler settings. Optimizing Doppler parameters e.g. scale wall filter is crucial for assessing blood flow dynamics accurately. Optimization strategies. Regular maintenance and calibration of ultrasound machines ensure consistent performance. Continuous training for sonographers to keep updated on the latest techniques and technology can enhance image acquisition skills. Employing advanced techniques such as harmonic imaging or elastography can further improve diagnostic capabilities. What are the critical considerations for maintaining radiation safety during fluoroscopy procedures? Answer. Maintaining radiation safety during fluoroscopy procedures involves several critical considerations. ALARA principle. Adhering to the ALARA as low as reasonably achievable principle is fundamental. This includes minimizing exposure times, using appropriate equipment settings, and optimizing the patient's position to reduce radiation dose. Personnel protection. Use of lead aprons, thyroid shields, and protective glasses for staff involved in fluoroscopic procedures minimizes exposure. A distance of at least 6 feet from the radiation source is recommended when possible. Equipment calibration. Regular maintenance and calibration of fluoroscopy equipment ensure accurate dose delivery and optimal imaging quality. Compliance with regulatory standards and guidelines is essential. Patient dose monitoring. Utilizing dose monitoring systems helps track the radiation exposure received by patients during fluoroscopy. Awareness of cumulative dose and implementing protocols for high-dose procedures is crucial. Education and training. Continuous education for staff on radiation safety protocols, techniques to minimize exposure, and recognizing signs of radiation overexposure can foster a culture of safety. Use of digital imaging. Transitioning to digital imaging and advanced fluoroscopy techniques can reduce dose while enhancing image quality. Evaluate the impact of digital technology on radiology, specifically regarding image acquisition and storage, and the implications for patient care. Answer. Impact of digital technology on radiology. Image acquisition. Digital imaging modalities, such as digital radiography, doctor and computed tomography (CT), allow for immediate image acquisition, reducing patient wait times and facilitating timely diagnosis. Advanced algorithms in digital imaging enhance image quality, enabling better visualization of anatomical structures and pathologies. Storage solutions. The advent of picture archiving and communication systems (PACS) enables efficient storage, retrieval, and sharing of images. This facilitates collaborative care, allowing multiple healthcare professionals to access patient data seamlessly. Remote access and telemedicine. Digital technology supports teleradiology, allowing radiologists to interpret images remotely. This enhances access to expert opinions, especially in rural or underserved areas. Artificial intelligence (AI). AI integration in radiology aids in image analysis, improving diagnostic accuracy and workflow efficiency. AI algorithms can assist in identifying abnormalities, thus reducing human error. Patient care implications. Improved imaging techniques and faster turnaround times contribute to more accurate diagnosis and timely treatment, enhancing overall patient care. Patients can receive better education about their conditions through shared digital images, fostering engagement and informed decision-making. Conclusion. The impact of digital technology in radiology is profound, leading to enhanced efficiency, accuracy, and quality of patient care. However, ongoing training and adherence to safety protocols remain vital to optimizing these technological advancements.